Now, since the start of this year, more than 50 people under the age of 18 have been victims of non-fatal shootings across Indianapolis. Fox 59's Courtney Spinelli interviewed a trauma surgeon with Riley Hospital who says the impacts of these shootings can last a lifetime.
Bullets spare no body part.
Dr. Matt Lamman and the trauma team at Riley Hospital for Children know how severe gunshot injuries can be, even for survivors.
We've seen patients who've been, for instance, paralyzed for the rest of their life. We've seen patients lose arms, legs, pieces of their intestine.
The impacts aren't just related to the physical trauma or surgeries needed to save a person's life. Lamman says a person's reaction to a traumatic event can spiral into something much worse if it's ignored.
We work with our teams to try to treat, and if untreated, those are the things that lead to long-term mental health problems.
One of those long-term problems, post-traumatic stress disorder. And while Riley also treats patients from beyond Indianapolis, they're seeing a trend right now.
We've definitely seen an increase in the number of firearm-related injuries.
In Indy alone, more young people have been injured in shootings in the first 7 months than through mid-August of last year. Since the start of 2022, 55 people under 18 have been shot and survived. 44 were male, 11 were female.
We've treated in 1 week probably more victims of gun violence in 1 week than any other week that I can think of for the last 7 years.
Last week alone, Lamman says they treated 5 shooting victims in 5 days. Lamman also thinks about the people he never even had a chance to help.
You know, that is an area in which I, as a trauma surgeon, never even had the opportunity to try and save a life.
Lamman hopes the community remembers one pull of the trigger could change countless lives forever. Reporting in Indianapolis, Courtney Spinelli, Fox 59 News.